This session is sponsored and programmed by Change Healthcare.
Hello, I'm Rhonda Schaffler. Today I'm speaking with Stephen Martin, Executive Vice President of Enterprise Technology at Change Healthcare. We're going to talk about the ways that the healthcare industry can drive transparency with embedded artificial intelligence. Thanks for joining us today. Stephen, over the past 12 months, we certainly saw the importance of technology in healthcare in light of the COVID pandemic. How does AI fit into healthcare technology?
Yep, there's lots of places where artificial intelligence and specifically machine learning can fit into healthcare. As you know, those delivering care have a lot to juggle. They make hundreds, maybe even thousands decisions every single day on what's in the best interest of their patient. AI can help with things like reviewing records for errors. It can recommend additional steps which are consistent with the standard of care. It can look for other opportunities to truly engage a patient and make sure that they're getting the best possible care that can be delivered. We also look for opportunities to take into account lots and lots and lots of data that recommend courses of action based on others with similar circumstances.
Why is artificial intelligence so complicated?
You bet. And it's complicated for a couple of reasons at a high level. First, you have to have massive amounts of data. To build these models for them to be of any value, you have to look at lots and lots and lots of information. Terabytes, petabytes of information have to be aggregated and reviewed to be able to do it. The second thing is that there are dozens of models within artificial intelligence and machine learning that we can use. And it takes a really trained eye. It takes a lot of work, folks that are dedicated in this profession to understand which model is most appropriate to use to digest the data for this particular circumstance.
And then how can it be applied to an already complex healthcare system?
You bet. Something as simple as doing error checking on coding is a huge value add. So reading at charts, looking at the codes, looking at what the provider covers, understanding what's going on with the patient, just eliminating errors in those charts is a huge benefit and something that streamlines it. One of the biggest complaints that we get from healthcare providers is the time that they take away from their patients. And technologies like this simplify that aspect of their job, allowing them to focus more energy back to care.
Yeah, it certainly makes sense. You started to get into this a little bit. Can you explain further some of the benefits that you see with AI in healthcare and give me a few other examples?
Yeah, you bet. So take a particular example where a doctor is interfacing with a patient and they only know as much information as that patient has with them. Maybe they've been seen at multiple hospitals. Maybe we don't have an exact record of what's going on. But using data aggregation on the back end, we may be able to find things that are going on with that patient, a test that they didn't necessarily remember, and provide more information so that the doctor is less reliant on that initial amount of information that was conveyed by the patient themselves. And so taking that on the back end, they may have forgotten that they did a glucose test a year ago. They may have forgotten that they saw a doctor or actually were even on a blood pressure medication. And so having that information and being able to factor it into what we're looking at and to look at the recommended path versus what's going on could be a huge value add. Nothing on the technology side is ever going to replace healthcare providers. That's not even the attempt. What we're trying to do is to make sure that our healthcare providers could be the best that they can possibly be by arming them with the most information, helping them understand what's going on, what has been helpful in other cases with other patients in similar circumstances, and see if that helps them think through a particular situation, particularly a complicated one, and do so in near real time. Keeping them in front of the patient, engaged with the patient, rather than sitting in a back office looking up charts, we think is a huge benefit for our healthcare providers.
I like this example of kind of the one-on-one healthcare versus patient care. And when I think about the benefits, I also want to step back and think big picture, the big impact for the entire healthcare industry overall. What do you see on that front?
You bet. We can spot trends in care at a fairly early time horizon, right? So to be able to look at what's going on at a regional level or a national level, we can begin to spot trends, and that may be useful to doctors that are or nurses that are presented with a particular case with something that they haven't seen before. Every day is an adventure in the healthcare space when it comes to delivering care. And so by providing information that's aggregated, helping them make sure that they understand what's going on regionally and nationally and even beyond, could really help speed delivery in reducing the research in terms of figuring out what's going on with a particular patient. But I think your underlying question hits a really important topic, because one of the things that we need to help figure out in this industry, and it sounds a little nerdy, but it's important. Think about a particular doctor. If they don't use any other reference material from other doctors, then their knowledge is only the patients that they've seen. If they do a good job of communicating with other doctors, maybe at their hospital, then that's their point of reference. Maybe they do a good job there. But we're looking for an additional layer of aggregation. We want to arm them with information with lots of doctors that are seeing patients on a daily basis, make sure that they have that information in hand. And that's part of what they're taking into account when they go back and think about what the appropriate course of treatment is for a particular patient in a particular circumstance.
Stephen, I think nerdy is a plus, by the way. I just want to say that. All the changes in healthcare, can it even be managed without AI?
Absolutely, you can. I mean, we always have the right to continue doing what we're doing today, said John Henry to the jackhammer, right? But we also have the right and the ability to evolve, right, and to do things better. And again, I think there's always fear when we see technology, particularly like this. The worry is that it's going to automate. I'm not going to have that close relationship with the doctor. A doctor or nurse is not going to be able to make their own decisions in real time on what's going on, and that couldn't be further from the case. What we're trying to do is to help them be the best they can be and spend less time doing paperwork and doing research by making information in mass available and showing them what a similar patient in some similar circumstance looks like, and doing things like looking for errors on a chart, and so that no one is spending any more time than they need to on billing processes.
What's the downside of not applying it or misusing it?
Yeah, and they're two completely independent things. So not doing it, we think those that don't will fall behind, right? Your ability to correctly diagnose situations, factoring in broader context. The world is both flat and federated now, right? In an epidemiological sense, right? And so we have a lot of interaction between patients and someone that has an issue in India and then in the UK and in the US very quickly can be an issue. And so having massive amounts of information get to the right answer very quickly. So not doing that, it's going to reduce our healthcare workers' ability to deliver care very quickly, and that is critically important. Misuse, which you also said is a critical area as well. And there's two things that we talk about within misuse. Number one, going back to that prior example, not enough data. Right. Again, if one particular facility attempts to do this using only the inputs that they have locally, likely not enough information to do it in a high fidelity way, and it could lead to some wrong conclusions about the patterns that we see, because you have to have lots of data to make this work. The next thing that we see in misuse is using the wrong models. Again, not applying the right machine learning model, not really understanding the depth of the issue that we're looking at, getting confused about correlation and or causation. In many cases, those kinds of things can be problematic, obviously. So it's very important that we, one, have as much data as we possibly can when looking at these kinds of issues, and two, we use people that are really trained very deeply in this profession to ensure that we're using the right models to get to the right outcome.
And that's all the time we have. Thank you so much for joining us.